The simple interrupted suture pattern. This is one of the most common suture patterns that you will perform in this course and in life, and so it's very versatile, very well versed to be used in various tissues, and a very common suture pattern to perform, as mentioned. I'm right-handed, and so I have my needle properly applied in the needle holders. The needle holders are put just beyond or toward the swagged on end from the middle of the needle, and the needle is at the end of the needle holders, and the needle holders are clamped and secured in position. I have the rat tooth thumb forceps in my left hand. I'm going to grasp the skin portion of the daisy here on the near side. The near side is the side that is nearer to the surgeon's dominant hand. In this case, it's the right side of the incision. And notice that I have the daisy oriented longitudinally here, but obviously this suture pattern can be done very nicely with the daisy oriented 90 degrees to this axis as well. I'm first going to put the needle in. I'm going to be about 5 to 8 millimeters beyond the skin edge here. I'm going to go through the skin portion of the daisy. Now, you could go directly across, but you can see I'm running out of room, and so I'm going to encircle the needle with my thumb forceps. I'm going to grasp the needle again, clamp. Now I'm ready to put my suture through the far side of the incision. Grasp by encircling, and then I'm ready to pull the needle out for the second bite of my suture pattern. Now what I'm going to do, I'm going to grasp that needle, and now I'm going to gather my suture. And those various gathering techniques that you can use. And you want to leave yourself a fair amount of suture with which to complete your knot for this simple interrupted suture pattern. Now the daisy tends to have some tension, and so a simple square knot oftentimes does not suffice. And so I'm going to do a surgeon's throw. And you can even see here that there's still tension there, followed by a simple throw, constructing a surgeon's knot, completing the simple interrupted suture pattern. Now you could then put additional throws on top of your surgeon's knot. So this would be a surgeon's knot followed by 2 additional throws. And once I've cut these ends, I've constructed the simple interrupted suture tied with a surgeon's knot and 2 additional throws.